My name is Brady Barker. I'm an orthopedic surgeon here in Provo and Orem, Utah, specializing in all musculoskeletal care, in particular in reconstruction of diseased hips and knees. An anterior approach really talks about where we make the incision. In the older type of hip replacements, we'd make an incision in the posterior aspect or the back side of the hip in the buttock area. The advantages of going through the front are multiple, and they include the fact that it's less invasive. In the back of the hip, we have to take muscles down off the bone to be able to put the hip replacement in. In the front, we're able to work between the muscle planes, and so it's much less invasive, and that leads to patients recovering faster and having less pain. Because we don't have to take the muscles down, there's a much less chance of the hip popping out of socket as well or having a dislocation. So the dislocation rate is low enough going to the front of the hip that we don't really give patients restrictions as far as what position they can get their hip in after surgery. Having the incision in the front also makes sense because if you have to sit on your incision, anyone that's had surgery in the past knows that your incision is painful for many months. And so the fact that having the incision in the front leads to less pain with those kinds of activities as well. The other advantage is during surgery for the back side of the hip, we have patients positioned on their side. And so we have a harder time getting accurate x-rays during surgery. And in most cases, we don't use x-rays during surgery because they're not reliable. With the anterior approach, the patient's positioned on their back. We can use x-ray during surgery so we know for sure that all the components are positioned optimally, that we've got the right position, the right size, and the right orientation, and the right leg length before we leave the operating room. So we can almost guarantee a much better result as opposed to that as well.